Hello, good evening. Welcome to my IVF Fences and the European Fertility Society. We are back with another webinar, so I'm glad to be back here. And if you've been to our previous webinars, you know that we have lots of things to discuss today, and we have definitely lots of important things to give you some tips, I guess, but also to answer your questions. And today's topic is definitely an interesting but also difficult and also very, very, very needed topic. And we have a special guest with us today, and I'm really happy that you decided to join us today. It's lovely to have you. With us today, we have Dr. Mariana Sousa-Leite, and I'm really happy to have you. How are you feeling today? I hope you are ready to provide some tips and information that is definitely needed.
Thank you. Thank you for the invitation, and it is a pleasure to be part of my IVF answers from EFS. So I think I will share my screen, and I can.
Oh, you can start your screen, sharing your screen.
Yeah,
so let's have
present what I'm going to talk about.
In the meantime, let me just properly introduce you so everyone knows why we are talking about social support and why Dr. Mariana is actually the best person to discuss this, because she is the research associate at the School of Psychology at Cardiff University in the UK. So she's definitely done lots of research on this particular topic, and we know that this is something that is not discussed as much. And of course, as you know, we are here every single week, and mostly we focus on medical events, but this time, of course, we want to also talk about paid IVF treatment and how to cope with that. And this is why we have invited Dr. Mariana for today. And I guess we can start sharing your screen. So let me see if it's working. Okay. And remember, it's all being recorded, and of course, you can ask the questions in the chat right after we finish the presentation. We will go ahead with the questions that you have, and I can see the presentation. So we can start. Please let us know if you can hear us and you can see the presentation so we can make sure, but I think everything is working and we can start.
Thank you so much. As Caroline was saying, I'm a postdoctoral fellow at Cardiff University, and I have been focusing my work and specifically my PhD on developing and evaluating support for fertility patients to prepare and better cope if and when treatment does not work. And so this is what I'm going to talk today. I will describe how this outcome can have an impact on patients' well-being. I will review the evidence-based resources currently available to support patients coping with this difficult and sometimes unexpected outcome. And in the end, I will open a discussion to hear your experiences, views, feedback, wherever you would like to share. Or not, it's okay. But please feel free to interrupt me if you would like to discuss or share any opinion or concern while I'm going through the presentation. So I think I will start. I will start briefly with some stats. And according to the latest data from the HFEA, more and more people in the UK are currently using fertility treatment, particularly IVF, to have children. These data show that most patients do one or two treatment cycles, with only around 15% undergoing 3 or more cycles. So most patients do 1 or 2 cycles of IVF. However, even undergoing a single cycle of IVF can be physically, emotionally, relationally challenging. The data indicate that almost half of the patients end treatment without the children they desired. When I refer to end of treatment, I mean when the patients end the last treatment cycle and this cycle does not work and no new cycles will be attempted. So it is the end of treatment, the end of all cycles. Data from interviews, focus groups with patients show that this outcome can trigger feelings of loss and grief, anger, emptiness, or isolation. Some patients describe this as one of the worst experiences I've ever had in my life. I want to say that with time, most patients find peace and healthily adjust to this outcome. However, and although treatment not working is a common outcome in fertility care, research shows patients often feel ill-informed and ill-prepared during treatment for this outcome. Patients report feel abandoned by their clinics and left to cope with this undesired outcome on their own. So in sum, with this evidence, I want to stress the challenge of undergoing treatment and the burden that ending it without a child or the desired number of children can be. How patients describe their experience and how they cope with the treatment outcome can be affected by the routine care provided by the clinic. Research on patients' evaluation of clinic care show that more positive experience can be reported with more patient-centered care. So care that is that meet patients' values, expectations, needs. However, fertility guidelines and regulators show that there is a lack of clinic recommendations and evidence-based support for patients when treatment does not work. So a lot of things exist and support exists for before and during treatment, but there is a lack of resources and support for when treatment does not work. This is a description from a systematic review and meta-analysis of what patients say, what they can experience when treatment ends and does not work. For example, and as I said, they felt abandoned by their clinic, perceived a lack of support in deciding if and when to end treatment, and once this decision was made, they express a need for psychosocial care or counseling to help them cope with the intense grief. So we launched a bilingual online survey on patients' experiences, willingness, and preferences for being counseled in advance, so before the treatment ends, about the possibility that treatment may not work. We call this preventive support for the end of treatment. So to prepare patients and inform about the possibility that treatment may not work before the treatment ends. Results show that 9 in 10 patients would be willing to receive this preventive care support. However, only 1/3 reported receiving it, and most said that these discussions did not target all the topics they would like to. So what did patients say? This survey showed that most patients want to have this conversation about the possibility that treatment may not work before initiating their first IVF cycle. Most would like this to be multidisciplinary, mainly from a mental health professional and a consultant. And patients would like to discuss coping strategies if treatment does not work and receive help managing their expectations and fostering a hopeful outlook towards the future. They would also like to receive an overview of the treatment plan and all possible treatment outcomes, and be offered available supports and discuss other routes for parenthood and alternative life goals. So we conducted focus groups with patients, patient advocates, and healthcare professionals from Europe and Latin America to better understand this preventive support for the end of treatment. Results showed that all stakeholders consider these supports to be essential. Nonetheless, both identified possible barriers and benefits. For example, on the one hand, both patients and professionals mentioned that this support could help patients better cope with treatment not working, make more informed and timely decisions, and better manage expectations regarding treatment and parenthood. On the other hand, talking about in advance about the possibility that treatment may not work, both, but more so the professionals, indicated that this support might trigger emotional distress or reduce patients' optimism and commitment with treatment, and pointed out a lack of know-how and resources to provide this support to patients. And here are some quotes to illustrate this. For example, if I would have been braced for the reality, I would have done things differently. For example, a nurse said the reason why many clinics don't have that conversation early enough is because they don't have anything to really offer. So in these focus groups, we co-developed online educational resources to promote this preventive care, these preventive practices as a routine in fertility clinics. So the result was these 2 online pages, freely accessible for public use on these websites or QR codes. These pages are translated into 4 languages. We developed 1 page for patients to help them navigate the possibility of treatment not working, and another for healthcare professionals to help them provide this support. So I will show you a video of these 2 web pages, so the page for patients and the web page for professionals. So this is the web page for patients. So the web page starts with a video animation about introducing the topic that treatment may not work. Then it starts to how to continue your journey if fertility treatment does not work. And this page is split in 3 sub-pages, I will say. So the first one is to support patients contemplate the possibility that treatment may not work, learn a little bit more. Another sub-page about to explore other routes to have children, for example, adoption, fostering. And another page that is, I don't know if you already knew about that, but is about my journey, an app. I will talk a little bit later today, to help everyone who wants to build acceptance of their unfulfilled wish for children. And for example, it could be fertility patients who end treatments and are ready to build acceptance, to accept their unfulfilled wish for children. So this first page about the end of unsuccessful fertility treatment starts about why it is important to plan in advance about what might happen. Then we have 10 facts about ending unsuccessful fertility treatments that it might be important for patients to know. We have other routes to have children, different types of support available, for example, in different countries, associations that can be contacts to support fertility patients. Then the link for the app I told you about, My Journey. And then you have some questions, common questions that patients might have. For example, how do I know when treatment ends? How may I be affected if treatment does not work? Can I reach closure from my fertility treatment? And so there are some answers to support patients, fertility patients. And then the other page I told you about, it is has some contacts about other forms of parenthood. So this is the page for patients. Then we have the web page for healthcare professionals, for clinics. So this page aims to support healthcare professionals, help their patients coping if treatment does not work. It starts to explain why it is important to mention this possibility and prepare patients for this possibility, when to do it according to patients' preferences, express preferences based on research, how before treatment ends, and if they are with a patient that already faced the end of treatment. And then the 10 facts I just told you about with other routes to have children, what patients might experience, what might be a plan B, and then again, how to answer some questions and concerns that patients might have. For example, what should I advise patients who are undergoing treatment to help them cope if treatment does not work? How can I support my patients? How to signpost my patients for available support? Then we have some poster. We have a pamphlet with the 10 facts I just told you about. For example, a poster to put in the clinic with the website for the patient's page. Then the video that it is embedded on the patient's web page. And then some supporting research. So these are the 2 pages that we believe are first web pages, at least the ones that are available for public use, but I don't know any others, to support specifically to prepare patients for the possibility that treatment might not work. So now I would like to move for and what available support do patients have when treatment does not work. So this is, to my knowledge, the only evaluated intervention accessible for public use to support patients after treatment. It's from Roboton and colleagues, and it aims to support all people who have this unfulfilled wish for children. So this intervention proved to improve the well-being of those who use it. It can be accessed on this website or QR code. This is a self-guided intervention, has not been tested specifically on the population of fertility patients, and does not support a specific transition of the treatment end. So in response to this need, we developed Beyond Fertility. Beyond Fertility is a brief face-to-face psychosocial intervention offered online or in person, aimed at promoting patients' adjustment to the end of treatment when it does not work. So the development and evaluation followed evidence-based recommendations. Its Portuguese protocol is available on this website, and it is to be offered by a mental health professional. It has a component of preventive support, as we have spoken, via one individual couple session before patients start their last treatment cycle to prepare them for the possibility that treatment may not work. And then a component of intervention support via one individual couple and 5 group sessions to support with other patients, to support them if and when treatment does not work. So this is to all patients, and this part is only for those who actually face the end of treatment and it does not work. So it is an individual couple session and then 5 group sessions. So Beyond Fertility is tailored to target these 4 psychosocial processes that research has shown to be the ones that promote patients' adjustment to the end of treatment. So these are acceptance of the treatment process and the inability to achieve one's desired children by the means patients wished for. Perceived social and relational support, meaning making, which is the construction of positive meanings about one's efforts to have children and the re-evaluation of personal values. And finally, the implementation of new life goals congruent with these values. And these can be beyond, towards, and beyond parenthood. We conducted a small pilot study of Beyond Fertility, and here are some quotes from our qualitative analysis of the patient's evaluations of it. And these results align with these results align with these four processes as the mechanisms of change for better adjustment. For example, after Beyond Fertility, patients said, made us think we are not different, that the fears and anxieties we feel are common. It shows us through the dynamics there is a whole world beyond the pain. They valued the availability of tools for relaxation and guidance, the tools for self-compassion. And then through these emotions, we can set goals for a fulfilling and happy life beyond motherhood. We evaluated Beyond Fertility. I will not go into detail about this. I will just want to share some major points. So what we did was we split patients of 4 fertility clinics in 2 groups: the control group, which received the usual clinic care, and the intervention group, which received the Beyond Fertility intervention. Results show that when preventive support was offered via one individual couple session, remember the preventive care was one individual couple session face-to-face, in person or online, before the last planned cycle, it was moderately accepted and feasible to implement. However, results show that the last treatment cycle can have a multitude of trajectories and is difficult to predict in advance. So as you can observe, only 1/3 of the participants in both groups ended treatments when their last cycle did not work as planned. So the others here had the cycle postponed or cancelled, or were offered an additional cycle due to health complications, had cryopreserved embryos, or went to the private sector. Some achieved the pregnancy. So only 1/3 actually ended treatment, and it does not work. Results also suggested that this preventive support during treatment may promote uptake of support after treatment, because most patients in the intervention group, so those who were receiving Beyond Fertility, accepted the second session in an individual couple format after the treatment ends. However, although most patients accepted this second session, a considerable proportion rejected the group sessions due to not feeling comfortable. So, with an individual couple format being preferred in the immediate aftermath of the treatment end. We tested Beyond Fertility, and it showed a difference in quality of life beyond the control and intervention group, so those who received and those who did not receive Beyond Fertility, at 2 weeks and 6 weeks after the cycle ended. This suggested that benefits with preventive and intervention support may be achieved. However, I would like to note that this difference did not reach statistical significance due to the low number of participants. The trial had low power to detect effect sizes, the small to large effect sizes. So we need future high quality testing, and so future development and evaluation of Beyond Fertility need to consider the unacceptance of group formats and also the multitude of trajectories at the treatment end. I will end my presentation here. I would like, and I will do a summary. I'm sorry if I'm going too fast. But in summary, with this presentation, I try to highlight the importance of supporting patients for the end of treatment, emphasizing that even though treatment ends, clinical care doesn't have to end. So it can indeed be said that providing this support after the end of treatment is a clinical duty. This presentation showed that all professionals should be involved in routine psychosocial care for the end of treatment. And this should address the multitude of treatment options and trajectories, alternative paths to and beyond parenthood, when-to-end treatment, and support sources. And this care should be offered to all patients, women, men, and should be adapted to patients' values, expectations, and preferences. So it should be offered to all, but adapted to their values, expectations, and preferences. Thank you very much. I end my presentation here. I would like to thank Dr. Sofia Gameiro, Professor Rafa Figueiredo, and Dr. Raquel Costa, who supported the conduction of this work. Thank you, and I very much welcome your comments and questions if you have any.
Thank you. Sorry. Thank you so much. Losing my voice. I'm all here, of course. Thank you so much. Definitely lots of details, lots of research you've done so far, and it's really interesting to see. And before we start with your questions, I do see some questions in the chat. I also have a question for you, but before that as well, please remember, now it's Q&A time. So if there's anything you would like to ask or simply share with us, remember, it's all anonymous, and we are simply here to support you. So feel free to type in anything that's on your mind. And I would like to ask you, because of course you've done lots of research on this particular subject, and I was wondering, do you see actual difference nowadays that the clinics are actually also focusing on this part? Because obviously I think that I think it's changing, but of course, have you seen it? Like, have you seen some actual, do you have facts that actually, some clinics now focus more also on the after treatment part, after failed treatment part?
I'm not a practitioner, so I'm not in the clinic. So I just do research with them. What research shows is that the end of unsuccessful treatment, possibility that treatment may not work, tends to be avoided even in research. And even the ESRC guidelines show that most recommendations are during or before treatments. However, and research also show that the people start to be more concerned about this, even during other events. Professionals are concerned about that. Focus groups with healthcare professionals show that they want to address this, but they are concerned about what will be patients' reactions. They don't have guidelines, evidence-based resources, recommendations to tell to their patients. So I think the concern starts to be bigger now, but I think this is a little bit new, I would say, and much more needs to be done about this topic.
Exactly, lots of work to do, and of course here at EFS we are also working to educate everyone. That's why we are also here and discussing this. This is one of the reasons. But if you go to our website, you will see that there are other things that we try to do and spread the word, and of course invite researchers, doctors, anyone who is in the field to simply share and spread the word, and hopefully this will be changing. It's not going to change soon, but I'm sure that if we are talking about it, there's always a chance for improvement, right?
Yeah, even it's because it's a very sensitive topic. We are talking about sadness, grief. We are talking about very difficult emotions, and not only for patients, but also for professionals, because they are not giving what they are trying, and some research with healthcare professionals show that it's difficult for them also to say that treatment does not end in a pregnancy. And maybe we need to start also, but this is another thing about what is the success end of treatment, right? It's not about the healthcare professionals or the patients. It is what it is. So I think it needs to be talked very carefully, that, and it needs to be a balance between optimism, and it's not just saying the treatment may not work. It's about balancing what we can do in this case and try to help patients think about other options, but in the same moment trying to balance their optimism, because treatment also can work. So
Of course,
it's very difficult.
definitely. True. And I mean, I'm sure, even training is definitely recommended for professionals, right? So they know how to actually give this bad sometimes information how to cope with that as well for them, right? So
Yeah.
it's a complex thing, definitely a complex thing.
Yeah, and there is Cardiff Cardiff Fertility Research is developing training for staff about delivering bad news. There is research conducted by Sofia Gameiro as well, Bava, about that. So yeah, healthcare professionals also need training about this bad news and all this.
Thank you so much for adding that. I think that's definitely lots of things we need to still work on, but I'm glad that it's out there and you are definitely helping out. And let's have a look. First question we had is, what are the web pages, please? Are you able to perhaps type those in the chat as well, so everyone can have access to it? In the meantime, let me remind everyone that this is recorded, so if anyone would like to go over the research as well, there is a possibility for you to have a look and check it, so it will be possible for you to also watch it tomorrow if needed, or you can share with anyone who might actually need it as well, right? All right, let me have a look at the next question here. So Emma would like to know what resources are available for connecting with others who have had similar experience. I think sometimes it's very important for patients who had failed IVF treatment to, discuss it with someone who already experienced this as well, right?
So to my knowledge, if we are speaking about patients who face the end of treatments and are not doing treatment anymore, I don't know any evidence-based, so evaluated resources that can put you in contact with others. However, there are online pages and online groups, even from fertility charities that launched some groups. So you can look for it even in these pages. You can look for these associations. So even if EFS, also contact them. So so this would be more informal support, I would say. But there are a lot of support online about it regarding evidence-based support. So support that was tested, evaluated. I don't know any for now.
That's perfectly okay. Thank you so much for that. All right, Cassie, not a question, but my experience from IVF cycles. I haven't got any discussion about treatment not working, even though it sadly hasn't worked for us. That's not defined reason as to why it hasn't worked, which makes it feel more difficult because there's no why. A tough one, indeed.
Thank you for sharing. It's very difficult when treatment does not work and when people don't know the reason why. There is some research showing that at least saying that we don't know or there is no reason, it's already a reason for some patients, at least saying we don't know why, or but sometimes patients are left without answers, but sometimes it's because there is no known reason. But it's very difficult to accept when there is no reason or known reason.
Yeah. And this is a tough one for sure. But unfortunately, sometimes it's just impossible to simply have that, actually, the reason why, right? All right, let's have a look. Emma would like to know, so how do I navigate the pressure or expectations for people around me who don't fully understand this journey? And I believe this is another thing that happens very often.
Yeah, so I don't have a right answer, I would say, because I think it depends from person to person. Research shows that it is indeed very difficult to cope with depression and expectations from others. It is important to, I would say, to some patients say it is good to disclose with those people who can give us the support we need. Some other patients decide not to share with everyone because then it is difficult also always receiving message, although it is really good. It is because people care about us. It is difficult to always disclose, need to answer when patients are not prepared to answer at that moment when they are asked. I think this is something counseling would help to understand what type of answers. There is some work on that. What type of answers would be good, would work for patients to respond in these situations. There are some work on that. So for some patients, some type of work better, and for other patients, another type of answers work. So it is important to understand what works for us when we are dealing with those who knows, and even, for example, for some patients in social events where everyone have children and we do not, and all of that, even during
and
Christmas.
especially that Christmas is coming, so definitely, probably many times it's the more difficult time for many people, for sure. All right.
It's important.
Thank you so much.
Yeah, it's important to seek the support we need, and it's very good to receive and that support. Know that we are being supported, and for someone who understands what everyone is going through. So I think I would say to seek support and feel reassured with that support.
Yeah, that's for sure. Thank you so much. Of course, those, remember, as you can probably imagine, it's really hard to give you yes or no answer and give you a proper answer because there are so many sides to it as well. So of course, I do believe you understand that. We are doing our best, of course. And let's have a look. Someone is typing, so I need a minute to see what kind of question we have. And again, if you have anything that's on your mind, go ahead, type those in. Dr. Mariana is here to help you out as much as possible. There are resources. There are, of course, there are other groups as well. Of course, sometimes on Facebook, sometimes there are more, maybe you might need some professional who actually can help you out. So remember, this is something that you need to look out for as well. And in the meantime, we did receive one more question. So let's have a look. So can grief with long period of being confused, passive and filled with most diverse emotions and states affect our physical health? The question relates to preparation to new IVF procedure. Anything you can advise here?
I don't know if I fully understand the question. I think it's if can grief and the way I feel affect my physical health, and if that would affect the IVF procedure. So
that's how I understand it as well.
Yeah, I cannot answer, and I don't like to do it. I'm not a doctor, a medical doctor, so I cannot answer how your physical state is and how it will affect the IVF procedure, because there are a lot of physical conditions that need to be checked and need to be advised by a medical doctor. I can say that grief can influence the way we feel and what we do. And for example, if I'm sad, if I'm depressed, maybe I'm not going to an event, or I'm not going to do things that are pleasured. Maybe I might eat not so well, or my sleep is compromised. So this will affect my states. So this is what I can say, that grief can have an impact in the way that what I will do. And of course, if I don't eat properly, if I don't sleep properly, but it's important to understand that it is common to feel sad and to feel grief, and it is okay to feel that way, and it is okay to ask for help and to speak with someone who understands us. And as I said in the beginning, patients can, with time, adjust healthily and cope with these moments. But of course, if I face an unsuccessful cycle, I will feel a lot of grief and sad emotions, and that is okay.
Yeah. Of course, and it might be really difficult to start a new treatment if you're feeling this way as well, right? So this is something that you need to deal with, I think, before you actually go ahead with the next procedure as well. So you feel, I mean, confident as well that, yeah. I mean, I guess without hope, it's really hard to, start a treatment, right? All right. So let's have a look. Cassie has another question here. So did the research show that there are still benefits of counseling support session even where an individual feels very resilient and feels they manage well day to day, even though there's a new sadness that coexists? Thank you, Cassie. Interesting question.
So the support, you are asking if counseling and support is not only beneficial for those who are feel
comfortable, I would say, or they are saying that, I manage this well, right?
And so the psychosocial support and the counseling, the interventions that were developed even during treatment, because after treatment, only these and other, but it was for depressed women that reported depressive symptoms. So during treatment, there are many interventions to support patients, and they are not only directed to patients who feel depressed or so that they are also directed to patients who feel okay and they think they manage well the day to day. So even Beyond Fertility was for that patients, but Beyond Fertility needs further testing. So I will speak about other interventions that are that prove to be effective even for patients who are not clinical depressed or with clinical symptoms, that's for sure. Yeah.
All right. Yeah, thank you so much. And I do believe it was helpful for you. I don't see more questions. So if you have anything else, this will be the final call for the questions. But of course, thank you so much, everyone, for joining, and Dr. Mariana for your expertise and helping us out. And as I've mentioned, I know I'm repeating myself, but I'm really happy that we are discussing this topic today. It's definitely important to talk about it, I think, as much as possible. And we will be finished. I do see your thank you. Again, thanks a lot, everyone. Remember, it's being recorded. So if you or someone who might actually also need it, you will be able to find it on myavfences.com. There are plenty of research, but also websites where you can find some support as well. So thank you a lot. Before we finish, any final words, Dr. Mariana?
No, I just want to thank you all, and thank you all for attending and for the questions. I hope I was able to answer you, and thank you for EFS for the invitation and the opportunity.
Thank you so much indeed. It was lovely to have you, and I'm really looking forward to some more events like this. There are plenty of topics we could discuss for sure. So thank you so much, everyone. Remember, we are actually going to be back here tomorrow at 7 p.m. London time. We will talk about egg donation. So in Greece. So if this is something that you are interested in, join us. You can go to our website and sign up today. And I think that will be it for today. But thank you so much. Have a lovely evening, everyone. Dr. Mariana Sousa-Leite was our guest speaker today. Thank you once more, and have a lovely evening. Take care. Bye.
Thank you.